Thank you all for joining us tonight. Tonight, Dr. Jeremy is with us and he's going to be sharing how to balance your blood sugar. What are the things that you can do to know that maybe you have that condition if you're not diagnosed yet? Or if you do have it, some other natural ways that you can do for kind of preventative measures. But in the meantime, if you will, please drop your where you're from, and if you have blood sugar issues, or if you love somebody who has blood sugar issues. So without any further ado, Dr. Jeremy, take it away and share with us all your wisdom.
Thanks, Anna. Thanks for having me. My name is Dr. Jeremy Thornton. I'm an internist, a chiropractic physician, and a clinical nutritionist. I practice in Missouri. Been in practice 23 plus years. And my primary area of practice and specialty is in autoimmune disease and in chronic inflammatory conditions, which of course, that does include blood sugar problems, and diabetes is very inflammatory, as we will talk about. So like Anna said, please drop where you're tuning in from in the chat. And if you have a blood sugar problem, what that is, or if you have maybe a friend or a family member that has a blood sugar problem, would love to know who's tuning in and what you might struggle with, or maybe a family member struggles with. Also, as we get going, feel free to drop questions in the chat, because I'm not going to pause during the presentation, but I certainly will get back to the chat at the end and see if there's any questions. So just drop questions down as we go, and we'll certainly circle back around to those questions. And also a disclaimer, as Anna said, I am a doctor, but I'm not your doctor. And so anything we talk about today, I encourage you to bring this up with your personal physician to get direct guidance, and especially oversight into something as serious as a blood sugar problem is definitely something you don't want to mess with, right? We don't want to encourage anything that would cause you to might get into too low a blood sugar or alter medication or anything like that. So want to make sure that you are working with somebody to help you along your health journey. And so I'm going to screen share. I'm going to go pretty fast tonight because I've got a lot of information to cover, and I don't want to keep you here all night, right? Because I know you guys do not want to hear me blab about blood sugar disorders all evening long, right? We've got other things to do, and there's only so much we can absorb. So I'm going to try to fly through the information, but also try to make it valuable. And also here, as we're going along here, if you can think of somebody that didn't or wasn't able to hop on this webinar, that get with whoever invited you tonight. We'll get you the recording. Because there's likely somebody you might think of that needs to hear this that wasn't able to hop on, and we want to make sure that they're able to get a copy of this. So reach out and we will get you a copy. I'm going to share my screen here and share some slides. All right, let's see here. All right, Anna, can you see my screen? Awesome, awesome. All right, so this is my ironic post here. KFC says they will donate $1, and you can get a mega jug of Pepsi for $2.99, and they'll donate $1 to Juvenile Diabetes Research Foundation. Help us find a cure. Anyway, diabetes is largely thought of to consist of just 2 types. However, we're going to talk a little bit about a type 3 diabetes. If you've never heard of that before, we're going to touch on that. But type 1 diabetes is an autoimmune disease. I don't know if you knew that, but type 1 is where your immune system actually attacks your pancreas, actually attacks what they call the beta cells that produce insulin in the pancreas. And so, of course, if there is damage to those cells, they can't produce insulin. This causes insulin dependence, right? This is insulin dependent diabetes. And type 2 is really lifestyle, okay? The body cannot properly use the insulin due to insulin resistance. So we start to get some blood sugar elevations. We're going to go into all the details of how that happens. And I think you'll have a really good understanding what insulin resistance is and how that works. Type 1 is usually diagnosed in youth. It can be later than that, usually diagnosed in youth. And then type 2 is generally us older folk. But I tell you, there's an alarming change in what I'm seeing in my practice of youth, especially teens, already pre-diabetic. Just due to lifestyle factors. Of course, we know that our kids are getting more and more overweight. We see evidence of that, but they're also developing blood sugar problems. Type 2, adult would be typically adult onset. We're seeing alarmingly high levels in our kids. Some symptoms here that can happen with diabetes is extreme thirst, feeling hungry, even when you've just eaten. Because there's poor utilization of fuel, right, with diabetes, frequent urination, slow healing in the body, so cuts and sores could be slow to heal, numbness in the hands or feet, neuropathy, right, often called in diabetes, and blurred vision, because obviously the small blood vessels in the eyes are very sensitive to blood sugar problems, and we can have conditions in the eyes. Diabetes is the 7th leading cause of death in the US. You can see the others. And honestly, a lot of these tie in with diabetes. Alzheimer's is diabetes, or diabetics have a much higher rate of developing Alzheimer's and cancer and heart disease. So fast facts, when I first saw this, I thought it said fun facts. I'm like, why are they advertising fun facts on diabetes? But it's fast facts on diabetes. There's 34.2 million people with diabetes in the US. That is roughly 10% of the population. I think that is huge and scary. Their pre-diabetes totals 88 million. And that is over 1 in 3 people have prediabetes, and 9 out of 10 of those people don't even know it. Okay, we're going to talk a little bit about what prediabetes is and how we can tell if we're starting to have blood sugar problems. Let's see here. So prediabetes, 88 million, more than 1 in 3. This is total cost for diabetes, and this was back in 2017, 327 billion in the US, 237 billion is direct costs, and 90 billion from reduced productivity, right, due to the illness itself. It said 1 in 4 healthcare dollars goes towards diabetes. That's a lot. Major complications. So we hear a lot about diabetes, but sometimes we forget about things associated with diabetes. Curious if you've seen this either yourself or in family members, but high blood sugar can affect those small blood vessels in the eye, like we talked about earlier, causing retinopathy, cataracts, glaucoma. It can affect those small vessels also in the kidneys, leading to kidney disease and nephropathy. Neuropathy, shouldn't put those words back to back on me like that. Neuropathy is, of course, when that high blood sugar damages the lining of those peripheral nerves, and so we start to get numbness and reduced sensation, especially in the feet. Right, and diabetics can get wounds and not know it, and that can lead to, of course, infection and gangrene, like we mentioned, very slow healing. And let me drag you guys out of my way here just a second. In the brain, increased risk of stroke, cardio or cerebrovascular disease, including TIAs and cognitive impairment, and a huge one is Alzheimer's disease. We're going to talk a little bit more about that. In the heart, high blood pressure, increased risk of coronary heart disease. In the extremities, we have peripheral vascular disease, where we start to have reduced not only sensation, but reduced blood flow into the lower limbs, right? And one sign of that is somebody will tend to start to develop really thick nails, right? A lot of times we think that those are fungal overgrowth, and sometimes it is, but a lot of times it's just due to reduced circulation in the feet. We get this really thick, built up toenails, right? Another Another finding, of course, is if you squeeze on your fingernails or your toenails and it's really slow to pink back up again, right? That can be a sign of reduced circulation starting. Another thing is, especially in men, we should have hair on our lower legs and our feet or our toes. And if we start to lose that, we're starting to develop some peripheral artery disease. And Alzheimer's, like we mentioned, is now being called type 3 diabetes. And this one says the brain is on fire, and that's true. So we're going to talk about insulin resistance, but what happens in the brain is those cells in our brain become resistant to insulin. And so basically, of course, sugar is the fuel that we're trying to get into those cells. And if we develop insulin resistance, that sugar is not able to get into those brain cells. And we start to have not only inflammation, but we start to have damage to those brain cells. And they're finding that this is a huge connection and even a cause to Alzheimer's disease, is this insulin resistance of the brain causing the inflammation and cell death due to basically cell starvation in the brain. I hear all the time that, well, I have diabetes because my mom had diabetes and her mom had diabetes. And there can be an increased maybe risk factor, but just because your parents or your grandparents or everybody in your one side of the family has diabetes does not mean that you're going to have diabetes. And I always like this quote, that genetics might load the gun, but it's lifestyle that pulls the trigger. Okay. And so in especially type 2 diabetes is a lifestyle disease. Okay. And it doesn't matter how many people on a side of the family has diabetes, does not mean that you're going to have diabetes. If you take lifestyle into consideration and make the changes necessary to help your body recover and start to be able to utilize insulin and blood sugar and sugar efficiently. Like I said, lifestyle disease with type 2 diabetes. Of course, type 1 is an autoimmune disease. All right, insulin resistance. This is a direct picture, Mike. This is a real cell picture right here. Under the microscope, we have the insulin is trying to get the sugar into the cell, and the cell says no. Okay, so this is insulin resistance, and what happens is it's just overconsumption of sugar and processed carbs and simple carbohydrates, which constantly spike sugar, which constantly demands the pancreas to pump out more insulin, right? So insulin has the key to unlock the cell to get the sugar out of the bloodstream and into the cell where we need it for energy, right? We make ATP out of that glucose. And everything goes fine for a while, but when we overdo that sugar over years and years generally, it's kind of like the cell. I like to use the analogy. It's like the boy who cried wolf. The cells start to say, whoopee, big deal, more insulin, right? And so the cells actually start to become resistant to that insulin. So the same amount of insulin is being produced. The cells say, I ain't having it. I've heard this story before, right? And so now that insulin isn't as efficient, isn't as effective as it once was. So what the pancreas does is it decides, well, maybe I just need to yell louder, right? So the pancreas just starts to crank out more insulin. And for a while that works. The higher insulin level drives that sugar into the cell. The cell gets tired of hearing that again, right? And doesn't respond as efficiently to that insulin and becomes even more insulin resistant. And this process just continues. More sugar, more insulin resistance of the cells, increased insulin production from the pancreas, until we get to the point where the high insulin level is no longer able to drive that sugar out of the bloodstream and into the cells, and now our blood sugar starts to climb. But by the time our blood sugar starts to climb, we are well into blood sugar disorders way before our blood sugar starts to climb because of this insulin resistance. And so these are some of the things we're going to talk about, how to look at this and spot this very early on, so that we hopefully don't proceed down that road of prediabetes and diabetes. So this is just another picture of the carbs and the sugar and the insulin released, the cells become resistant. The sugar's stored as fat. I call insulin the hibernation hormone, right? That high insulin that's in our bloodstream all the time from that insulin resistance just wants to grab a hold of everything and store it away, right? And then I like the word hangry, both hungry and angry, right? We feel this way and we feel tired because we're not efficiently getting sugar, the glucose into the cell to be used for energy. And so if we don't have that energy production, we're going to have fatigue. And so these are some things that I encourage you to have done, to have checked, even if you don't have symptoms, even if you have never had blood sugar problems before, to your knowledge, right? 1 in 3, I should pull everybody back up on the screen again, like the Brady Bunch, right? And you can look left and right and just think one of us has prediabetes. That's the stats, right? And so it's a great idea to either through your doctor or there's even labs nowadays in many cities where you can just go to the lab and say, hey, it's like a menu, right? At a fast food menu. I want the full meal deal here, right? I want my A1C and my fasting insulin and my inflammatory markers. You can just ask for tests and they'll run them for you, usually for cash, rather than running through insurance. But so the A1C gives us an average blood sugar of what the blood sugar runs over about a 3-month period, because they're looking inside the red blood cell. I won't get into all that, but the red blood cell lives about 3 months. And so they're able to tell from the A1C an average blood sugar. And so in an A1C below 5.7 is considered normal, and 5.7 to 6.4, this is where a lot of people get into trouble. This is that pre-diabetic range, right? This is that 34% of us are in that range. And what is it? 9 out of 10 don't know it. This is that pre-diabetes. And if we get to 6.5% and above, this is considered diabetes. All right. And this is the equivalent in a fasting blood sugar test. Okay. Fasting blood sugar is not my favorite way to test sugar at all, but it's generally included in a blood test. And the glucose tolerance test, I think, is archaic. And I think maybe it's almost like the older brother that just wanted to do something really mean to their younger sibling. That kind of reminds me what a glucose tolerance test is. You know, it's let's put this sugary drink inside this person that's enough to cause a diabetic coma. Let's give them this drink and let's just see what happens, right? That's a glucose tolerance test. Let's give them a whole bunch of sugar and see what their blood sugar does. That seems like a poor test to me, but that is a testing method. So I think a much better test is a fasting insulin test, right? This is how much your body is producing in a fasting state. Conventional range is 2 to 19 would be considered a normal fasting insulin. Optimal range would be 2 to 5. And this is a much better marker than your fasting blood sugar. And it's right up there with effectiveness of an efficiency, I guess, of an A1C. So I encourage you guys to get an A1C test and maybe a fasting insulin test done to check and see where you're at. And are you starting to slip into this pre-diabetic range? Because I'll tell you right now that this level right here is a lot easier to recover from, right? A lot easier to make some changes and reverse this than we wait, a few years and then now we're in the full-blown diabetic range. So hope that makes sense on testing. And so, I see a lot of the times in literature, in diabetic columns, journals, I hear people talking about managing diabetes, right? We hear that a lot. We're going to manage your diabetes. That's kind of like, I see that kind of like we're going to manage your cancer, right? I don't want my cancer managed, right? I want to get rid of it, right? And that's the same thing with diabetes. I don't like to use the term manage. How about we resolve the diabetes? How about we reverse the diabetes? And we don't hear that talked about a lot, but it's possible, it's true, and people do it all the time. People believe it's a life sentence when they get that diagnosis of diabetes, probably because their parents had diabetes or their grandparents, and they just think that that's their lot in life is to have diabetes and take this medication their whole life, right? And so I hate the term managed diabetes. Let's reverse. Let's get better than just manage. So this is something I see a lot. This is a common recommendation. And this is diabetic people aiming for 45 to 60 grams of carbs per meal and 15 to 20 grams of carbs per snack. I'll tell you right now, if you have diabetes, this is bad advice. Okay. If you're wanting to improve insulin resistance and encourage insulin sensitivity in your cells, this is way too many carbohydrates to consume on a daily basis. But this is common knowledge that's preached. And I could talk to a lot of theories on that, but I tell you one thing, diabetes makes big pharma a whole lot of money. Okay. So there's some school of thought would say the big pharma would rather diabetics not get cured, right? That diabetes doesn't get reversed, right? There's a lot of money, not only in diabetes, but all of the other health conditions that generally follow somebody that has diabetes, the increased risk of heart disease and cerebrovascular and cardiovascular and cancer and all of these different things. It's not surprising that we only hear about managing diabetes. We don't hear much about reversing diabetes, and that bothers me and it scares me. So here is, I'm going to move you guys around a little bit. There we go. So I can see on my screen. So some foods to incorporate. These are some things that will encourage better blood sugar management. So foods high in fiber, slows glucose absorption, aids in detoxification. These are a few avenues that you can get that increased fiber. Foods high in chromium. Chromium is very helpful in improving blood sugar balance. Magnesium-rich foods. Everybody that has blood sugar problems that I test has low magnesium. And that's would be a helpful test maybe to run as a red blood cell magnesium test to see if there's maybe a magnesium deficiency, which there commonly is. And magnesium is very important for blood sugar management. Healthy fats. Okay, we've got to have good healthy fats and clean proteins. These are great foods to incorporate if you're having blood sugar disorders. And this is one thing that I use with my patients that are trying to reverse their diabetes is a ketogenic diet. I think there's a lot of misinformation out there about what a ketogenic diet is. Some people think that it's just having a bacon on your hamburger covered and loaded with cheese every day. And that's not a ketogenic diet, right? This ketogenic diet should consist mostly of leafy green and above ground veggies. Okay. And it's more of a moderate protein, higher healthy fat approach. But one thing this is doing is dramatically lowering carbohydrate consumption during the day, right? So we have two avenues that we can use for fuel. So in blood sugar disorders, whether we're dealing with prediabetes or diabetes, this whole insulin blood sugar mechanism is broken, right? It's super inefficient. But if we switch our dietary approach here to a ketogenic approach, we are going super low carb, right? But what our bodies can do, and I think God did an amazing thing here when he made our bodies able to flip a switch and burn fat for fuel. Okay, most of us are what I call carbivores, right? We survive on carbs, and that's our main energy source all the time. Our body can also utilize fat and its own fat for fuel as well. And actually, when we do that, we produce what's called ketone bodies, and our cells can utilize ketones even more efficiently than it can utilize glucose, and that's because ketones don't require insulin to get inside the cell. Excuse me for a second. And so if you do this route, again, you want to be very careful, depending on your level of insulin resistance and diabetes. If you are a diabetic, again, you need to work with somebody on this, and you need to test frequently, because if we go low carb and you've not been low carb before, maybe you're doing the 60 grams of carbs a meal, and suddenly you're doing 20 to 30 grams a day, which is getting your body into ketosis. There can be some major fluctuations in blood sugar and insulin, and if you're on medications, probably a dramatic need for lessening those medications. And so let me move some things on my screen around a little bit. So we're going to avoid grains, wheat, rice, cereal, sugars, including honey and maple syrup, fruits, a lot of the sweeter fruits, and then your starchy vegetables. Those are things that we're going to avoid on a ketogenic diet. And when I work with patients with a well-planned ketogenic diet, I would say over 80% of our patients are able to reverse their diabetes. And that's just with lifestyle changes alone. And so that's one way. There's different ways to approach this, but this is a very efficient way to reverse those blood sugar problems. Artificial sweeteners, I see a lot, are a big problem and are just loaded with side effects. And so I'd encourage you, and this is another area I get really frustrated with, is because I see all of the sugar-free stuff labeled and targeted at diabetics, right? We see all, a whole section on an aisle will be these different sugar-free gum and candy and chocolates and different things, right? And it sounds good. It's sugar-free, so I'm not supposed to have much sugar, so I can probably have this. But generally those are loaded with these artificial sweeteners, which in and of themselves can still trigger an insulin response in some people, and has a whole list of other side effects, which we could probably talk all night on just that. But avoid these artificial sweeteners. This is an example. Let me see here. Also avoid ingredients such as maltitol, dextrose, maltodextrin, sorbitol, lactitol, glycerol. These are hidden forms of sugar in your foods. And this is an example. I posted this on my social media account the other day. You look at this, it says sugar-free, right? That sounds good. And another tricky thing is I circled right over here, made with stevia, right? We hear all of the health benefits of stevia. So we think this is going to be sweetened with stevia. So this is going to be healthy for me to have as a low carb or a sugar-free option, right? So a lot of people fall for this trick right here. If we look closer, you probably don't want to, but if you look at the ingredients here, you're going to see a whole host of junk that we could talk about. A lot of these items here. I won't focus on all of them, but they've a lot of, anything that has dextrose or ose in it is a sugar. We have maltodextrin. We have just all kinds of junk in here. There's a little bit of stevia extract, right? Should be false labeling. But one thing I want to point out to you is the maltitol syrup. Okay, maltitol syrup is commonly used in sugar-free things, diabetic treats, for example. And maltitol syrup actually has a glycemic index almost to table sugar. And this is in a sugar-free labeled item, supposedly made with stevia. Has maltitol syrup in there, which is going to significantly cause a spike in insulin, a spike in blood sugar, and is certainly not a healthy low carb treat as it is portrayed. But there's a lot of examples of this out there. And my main thing that I preach on is for the most part, eat real food, right? Not something that has this many ingredients on the label. And we're going to be in better shape. So these are some healthy, safe, natural sweeteners. Okay. And so if you're going to do anything to sweeten things, I'm a fan of stevia, allulose, monk fruit, erythritol, xylitol. Some people, those can cause some GI upset, so be careful with those. And but those are some safe ways to get some sweetness added to your recipes or your coffee or whatever that might be. Physical activity is a must for blood sugar disorders. It improves response to insulin. It lowers blood glucose. It lowers blood pressure. It controls weight. It reduces risk of developing diabetes complications. Here's some recommendations: 150 minutes a week of moderate to vigorous intensity exercise, and 2 to 3 times a week strength training. I like to use both of those, and exercise alone will drive glucose, even with blood sugar and insulin resistance and all of these problems. Exercise will drive sugar into the cell and allow it to be used for fuel. And so exercise will be a tool that you can use no matter what other approach you use. Exercise is always efficient at aiding in blood sugar regulation. Some nutritional supplements that I'm going to recommend: curcumin, which we're going to talk a little bit more about that in a minute. Chromium picolinate is a great one to add. Cinnamon, fish oil, those omega-3s are important. Alpha lipoic acid is an antioxidant that's amazing at improving insulin sensitivity. Bitter melon extract is another one. Some people will use cinnamon essential oil, and that can be very efficient as well. And 2 things that can actually have been shown and studied to repair the nerves in cases of things like neuropathy. Curcumin and alpha lipoic acid can help in cases of neuropathy. So we talked about curcumin here, and there's studies which we're going to talk about that show that curcumin, which of course comes from turmeric, right? I always call curcumin the medicinal component of turmeric. It decreases blood glucose and lipid levels. It increases insulin sensitivity of our cells. It increases muscle and fat glucose uptake. Let me move things around here a little bit. It improves liver and kidney function. It decreases lipid peroxidation, which is where we can start to develop plaquing in our arteries. It decreases oxidative stress, and it decreases inflammation. And it increases mitochondrial biogenesis. And what that means is our cells, you probably remember from biology, we have those mitochondria right inside the cell, which is the powerhouse of the cell that drives the energy production in our body. And curcumin actually causes our cells to make more of those, to create new and more of those mitochondria to produce energy inside the cell. And so I'm just going to touch on just a little bit of research out there on curcumin and what it can do for diabetes. So this is a review right here. The anti-diabetic activity of curcumin may be due to its potent ability to suppress oxidative stress. That's that free radical formation we hear about, and inflammation. It shows a beneficial role on the diabetes-induced endothelial dysfunction. Those are a lot of big words, especially for somebody like me from Missouri. But this endothelial dysfunction is that lining of the blood vessel that is damaged by the high blood sugar, okay? And it induces a downregulation of nuclear factor kappa B, which is a major player in inflammation in the body. Also reduces blood glucose and the levels of glycosylated hemoglobin, so that's our hemoglobin A1C. Another study here, let me move you guys around a little bit here again. This was a double-blind, placebo-controlled study over 9 months. And in this treatment, they had people was either placebo. What they were pre-diabetic people. Okay, they weren't diabetic, but they were in that pre-diabetic range that we talked about earlier. And so over this period of time, they gave some a placebo and they gave some curcumin. Okay, and after 9 months of curcumin, 16.4% of the subjects in the placebo group went on to develop diabetes. Okay, so that was without, of course they didn't have any treatment, but this was just a normal progression over 9 months. These 16.4% of these pre-diabetic people went on to develop diabetes. whereas none were diagnosed with diabetes in the curcumin treated group. So that's huge. In addition, in the curcumin treated group showed a better overall function of the beta cells. That's the pancreas cells that produce insulin. Their beta cell function was improved. Goodness, I gotta move things around on my screen here again. Bear with me. All right, and this one was a test looking at autoimmune diabetes, where they basically created autoimmune disease in this rat model. What they found is this curcumin treatment led to a significant delay, and this is type 1, this is autoimmune, this is a whole different animal here, but curcumin treatment led to a significant delay of disease onset, and in some instances prevented autoimmune diabetes altogether by inhibiting pancreatic leukocyte infiltration and preserving insulin expressing cells in the pancreas. So this was with type 1 diabetes. This is the effect of nanocurcumin on A1C, blood glucose, lipids in this randomized clinical trial. In the nanocurcumin group, a significant decrease was found in hemoglobin A1C, right, our average blood glucose, our fasting blood glucose, triglycerides, and basal index, and so, or BMI. And so that shows the wide variety. And I didn't mention earlier, I meant to, triglycerides are also a great early marker for insulin resistance. So a lot of times, even before blood sugar levels start to increase, the triglycerides will increase. And let's see here. Nanocurcumin supplementation reduced the severity of diabetic sensorimotor polyneuropathy, say that 5 times fast, in patients with type 2 diabetes. So this has the neuropathy component that we talked about earlier. Supplementation of curcumin was accounted for a significant reduction in A1C again, fasting blood glucose, reduction in total score neuropathy, total reflex score, and temperature. So our findings indicate that curcumin supplementation for 2 months improved and reduced the severity of this polyneuropathy in type 2 diabetic models there. And let's see here. All right. This one is just a crazy study. This is an animal study, but it's almost unbelievable that this could be possible, because in type 1 diabetes, when the immune system attacks and destroys those beta cells in the pancreas, that's usually it's a done deal, right? Those cells are destroyed. They don't come back. They don't produce insulin in those, in those destroyed beta cells. But in this study, again, this is an animal study, and so I'm excited to see what this might do in a human study. Hopefully, we'll see that soon. But basically, they created type 1 diabetes to the point that, or a model of type 1 diabetes, which led to the destruction of the beta cells in the pancreas of these rats, okay? And so they did an examination of the diabetic rat pancreas, and it revealed absence of islets of Langerhans. Those are the within the beta cells that produces the insulin. And so there was absence of those cells, right? And then they treated with curcumin. After 5 and 10 months from the onset of diabetes, the rat pancreas showed well-developed, larger sized islets. Okay, so let me move things around on my screen here again. So the curcumin possesses anti-diabetic actions and enhanced pancreatic islets regeneration. So in these animal models, and this isn't the only study out there, using curcumin is actually causing regeneration of new pancreas cells, which is just mind-blowing that something can cause this organ to regenerate, working beta cells, they're able to produce insulin. Amazing, super exciting, and possibilities for type 1 diabetics. When we're talking about curcumin, one of the hindrances and reason why a lot of the studies if you go and just go to pubmed.gov and search curcumin and about any disease process you might think of, you're going to be blown away at the volumes of research on these different disease processes, including things like diabetes. One thing you're going to also see is a lot of these studies are lab studies, right? Or they're animal studies. And they're doing things in cell cultures and basically in petri dishes, right? And in test tubes, and they're creating these different scenarios where they're showing that curcumin is doing all of these amazing things, which it certainly is. But the struggle has been that, as this study here talks about, that clinical trials show that curcumin is safe even at high doses, but exhibits poor bioavailability. So major reasons contributing to the low plasma and tissue levels appears to be due to poor absorption, rapid metabolism, and rapid systemic elimination. And so they're giving curcumin, which is in nature, it's a lipid-like, turmeric curcumin, it's a lipid-like substance, right? It's an oily-like substance, and we're trying to get this into the human body through the digestive system, into the bloodstream, which is mostly made of water, right? We know that oil and water don't mix well. So we're trying to get this curcumin into the bloodstream and ultimately into the cells where it can do all these amazing things. And what they're finding, they weren't getting the same results in the humans studies as they were in the labs. And that was because of this bioavailability issue. And this is why I'm excited to share a brand new technology with you that's called BioMS. And BioMS is actually a German technology that has overcome this barrier in absorption into the human body. So what they've done first off is this German technology has shrunk these particles down to less than 30 nanometers. Okay, so these curcumin particles are isolated out of the turmeric. They're shrunk down to a particle size of 30 nanometers, which, to give you a visual of what that is, a nanometer, if you take the thickness of your fingernail and you were to make 1 million slices into that thickness of your fingernail, and you pulled out one of those 1 million slices, that would be the size of a nanometer. And that's just hard to even comprehend or fathom that small, but this is the particle size that we're talking about. And then, of course, the curcumin, like I mentioned, is a lipid-like substance. So then they wrap this curcumin in a micelle, and a micelle is able to carry substances like curcumin in oil or water. So now we're able to easily get these curcumin particles because of this shell, this micelle shell is able to deliver this easily through the bloodstream, easily into our cells, and is doing just amazing things in the human body. So this, when compared to standard curcumin or turmeric preparations, is 277 times more bioavailable. Not percent, that's 277 times. And that is huge when you're looking at something as powerful as curcumin. I've used curcumin in practice probably greater than 20 years, or turmeric in different forms. And I've never seen anything that works like this and is this powerful. This would just gives you a little bit of another visual on the absorption versus micronized turmeric or native turmeric. And so this is really, I know that word is overused, but in my practice, this has definitely been a game changer. And I've used this, and like I said, I've used curcumin before, but even on my patients that we've replaced this technology with maybe the product that they were using, have seen dramatic changes. And of course, that makes sense if we're improving bioavailability by 277 times. And so this new technology is revolutionizing a lot of different treatment approaches, including chronic inflammatory conditions like diabetes. And so all of those things we talked about, we're seeing, but we've overcome that absorption problem with this technology. And that's what I'm super excited to share with you. Let me stop sharing my screen here if I can figure that out. Stop share. There we go. All right. So I knew it flew through a lot of information there. I'm going to check and see if we have any questions. Anna, is there anything else you'd like to share?
No, that was great. Very comprehensive. There was a few questions in here. I wanted to verify. You said men who have this issue typically lose their leg hair and then the thickness of the toenails, correct?
Well, men and women start to get thicker toenails generally.
Okay.
And sometimes they'll actually get those fungal toenails. I don't know if you've ever seen those before, where they're just super, super thick, built up, and sometimes yellowish, discolored. And sometimes that is a fungal infection, but it's brought on because there's no circulation getting down there. So thickness in the toenails, and also a loss, especially men. Some women may notice it, but especially men suddenly stop having hair growth on there, especially from the knee down. They'll start there. Eventually it'll be the whole leg, but they'll start from the knee down. And feet, they used to have hair on their toes, and now they don't have hair there anymore. And that's just a subtle sign that we're having some circulation issues. That could be other things besides diabetes, but it's really common having loss of circulation down to the feet. So
okay. And somebody asked, can that be reversed? The lacking of hair on the legs as well as the thickness of the toenails, can that be reversed?
It can. When we get to the source of, and of course diabetes is one source of, remember we talked about that endothelial dysfunction, which is the lining of those arteries. We start to get some hardening of those arteries. We get some inflammation in the lining of those arteries, which is a big factor in developing hardening of the arteries, high blood pressure, all of these things, which start to lead to disease, which will show up in places usually that are furthest from the heart, right? So that's going to typically show up first in our feet. It can even show up in our upper extremities, in our hands as well, but usually the feet first. And if we can resolve what's causing that vascular damage, what's causing that vascular inflammation, we're going to be able to restore circulation to those tissues and start to see some improvement in the health of those tissues, and the color of the skin, the toenails. We can, depending on how long it's gone on, I've had patients actually start to regrow hair on their feet and their lower legs.
Okay. One more question here on the diet information side. When referencing magnesium-rich foods, if you also wanted to add a supplement, which magnesium type is the best to add?
Well, that's a great question. There's lots of different magnesiums out there. Probably one of my favorite as far as overall absorption is magnesium glycinate. And sometimes you'll find some sources that use a different combinations of different magnesiums and maybe some chelated magnesiums. And there's some other good ones out there. But kind of one of my favorite go-tos is for absorption, especially, is magnesium glycinate.
Okay, perfect. Perfect. Okay, I think we've covered all the questions here, unless anyone wants to drop another quick one. I do want to thank you again, Dr. Jeremy, for coming and sharing with us again. Hopefully this has been helpful. And if you have any friends or anyone who needs to hear this, this will be in a YouTube recording, so you'll be able to share it with your friends and family who need to know that there is hopes from this amazing problem that we're having here in America with dealing with our blood sugar issues. So, so thank you once again, and have a good evening, and we will all see each other again, same time, same station, just a different topic next week. See you then.
Bye, guys.